Schaefer, and I am a licensed psychologist here in New Mexico. There's a little bit of a controversy about words that are used. There's been a movement in the direction of trying to use similar definitions so that everyone's on the same page. And so one of the things that is being encouraged is to use the term animal-assisted interventions, particularly when it applies to therapy work. So the thinking is with animal-assisted therapy interventions that you are integrating an animal into the goals of a client. Elsa was a Newfoundland that she and I started doing this work. She officially became a member of the NMSU staff. We had an ID made for her. When you're certified, Pet Partners isn't certifying you just for working with clients. They're certifying you as a therapy human and animal team. So things would happen like during that part of the exam, they had people yelling angrily at each other. Okay, someone would come in on a wheelchair and wheel themselves directly towards the dog. There would be a group of people that would come in and converge on the animal and pet, which happens a lot. So the animal has to tolerate like 10 people around them touching, being gently pushed, because some people don't know how to handle animals. There was a person that came in with an IV pole that was clanging. They would drop things, and they would watch to see how did the animal respond to these unexpected things, and how did you and the animal work together. So what they're looking for is, does the animal turn to you for guidance about what to do in these situations? Because if not, that animal is on its own, and it will do what it needs to do to defend itself. So they need to see that you're going to step in and defend. They need to see that the animal's temperament is such that it can tolerate surprises. So it's an excellent evaluation. For starters, she would be able to recognize who in the group needed her the most, and she would sit down next to that person, and she would get up in the course of a session and go to the person who was feeling very emotional at the time and just sit next to them. She didn't demand anything, but she knew what they needed. Working with a client who really, really struggled with asserting herself and was in a series of abusive relationships. And one of the things that she really wrestled with was speaking with a strong, assertive voice. She was kind of mousy and passive, hesitant, afraid. And so we started practicing with her, asking Elsa to do different things, to sit, to lie down, to come. And she would have to speak in a voice that would sound authoritative, So otherwise Elsa would just kind of lay there going, you want me to do what? You're not my mom. I'm not going to do anything. So she would have to speak with a command. And that was a very, very powerful. We rehearsed that many times. Over time, she started using that same voice with the relationships that she was in. And then eventually she left an abusive relationship. And I think that was part of it. It was one intervention out of many that helped to facilitate her confidence and help her find a voice. The client that I was talking about who was going through a divorce, he would actually sit on the floor, hold her head in his lap, and sob, openly sob. And she would be looking at me with a little bit of concern in her face. She would be like, is this okay? Until she learned, yes, it's okay. That drains the animal. They're absorbing all of that emotion. And so it's critically important to have breaks between clients. And one of the things that would happen here is therapists would come in to pet her during break time because therapists needed that soothing touch. And so I would literally have to carve out an hour where my door was shut and no one else could come in because she needed to rest. It's draining. It's draining on them. What you expose the animal to, you need to be vigilant about. You need to watch for signs of stress. And that takes some energy on your part as a therapist. So I learned to be very selective about the experiences that I would expose her to, and for the clients. You're monitoring both.
I was diagnosed with trichotillomania. I was diagnosed with trich in 2010, and basically what it is an anxiety disorder that if things get too stressful, too much, you obsessively pull out your eyelashes, and it can be with any hair on your body. It's just my specific one was my eyelashes. It just builds to a point and I just have to have some kind of release. My pets are definitely a help to me in that they'll always be there regardless of if I'm feeling just terrible and like I'm just sad and I don't want to leave my room. It doesn't really matter because they're living in my room and they just come up and be with me, and it's kind of like pets are there when you don't feel comfortable with people anymore. So no matter what, they still have the same happy personality and they try to make you feel better no matter how you're feeling, and even if you're happy, they make you feel even happier. My cat Ruth was just a stray and she's perfect in every way. I had a really bad anxiety attack last week, and it just got to the point where I was in the bathroom just sobbing on the bathroom floor, and Ruth doesn't really know what's going on, but I feel like she's more attentive when I am sad, and she'll just come and be there and she won't run away. She plays a role of support and love and compassion.